What is ibuprofen? When you need relief from pain, your doctor might suggest ibuprofen. This common medication helps with mild to moderate pain from various causes such as surgery, injuries, headaches, and muscle strains. Let's delve deeper into what ibuprofen is, how it works, and what you should know before using it. So, what is ibuprofen used for? Ibuprofen is versatile and used for different types of pain and conditions. After surgery or an injury, ibuprofen can help reduce pain and swelling. It's effective for treating tension headaches and migraines. If you've pulled a muscle, ibuprofen can ease the pain and inflammation. Beyond these, ibuprofen is also used to manage symptoms in chronic conditions like rheumatoid arthritis, which is an autoimmune disease causing joint inflammation, osteoarthritis, which is joint pain from wear and tear, and/or primary dysmenorrhea, which causes painful menstrual periods. Ibuprofen is usually available in tablet form, which you swallow. Over-the-counter ibuprofen typically comes in 200 milligram tablets. Higher doses, 400 milligrams, 600 milligrams, and 800 milligrams, require a prescription. So, how does ibuprofen work? Ibuprofen belongs to a group of medications called non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs work by blocking the production of prostaglandins, hormone-like substances in your body that cause pain, inflammation, and fever. By reducing these substances, ibuprofen helps to relieve pain and reduce swelling. Ibuprofen is a generic drug, meaning it's chemically identical to the brand name version, Advil. Generic drugs are just as safe and effective, but usually cheaper than brand name drugs. If you have questions about using Advil instead of generic ibuprofen, your doctor can help you decide what's best for you. So, what is the correct dosage of ibuprofen? Your doctor will recommend the correct dosage based on your condition and the severity of your symptoms. Here are some general guidelines. For rheumatoid arthritis or osteoarthritis, take 400 milligrams to 800 milligrams 3 or 4 times daily. For primary dysmenorrhea, take 400 milligrams every 4 hours as needed. For mild to moderate pain, take 400 milligrams every 4 to 6 hours as needed. Do not exceed 3,200 milligrams per day. For children, prescription ibuprofen tablets are not recommended, so consult your child's doctor for appropriate alternatives. So, what happens if you miss a dose of ibuprofen? If you're taking ibuprofen as needed, take it when you feel pain. For scheduled doses, like for rheumatoid arthritis, take the missed dose as soon as you remember unless it's almost time for your next dose. Do not double up doses. Is it safe to use ibuprofen for a long period of time? Ibuprofen is often prescribed for short-term use or as needed. However, for conditions like rheumatoid arthritis, it might be used long-term. Your doctor will provide guidance on how long you should take it. So, how fast does ibuprofen work? Ibuprofen generally starts to relieve pain within 1 to 2 hours after taking a dose. So, what are the side effects of ibuprofen? Like any medication, ibuprofen can cause side effects, ranging from mild to severe. These can vary based on your age, health conditions, and other medications you're taking. Mild side effects include nausea and vomiting, diarrhea or constipation, heartburn and indigestion, bloating and gas, headache, dizziness, skin rash, ringing in the ears, decreased appetite. Serious side effects include anemia, kidney damage, liver problems, vision issues, severe skin reactions, increased risk of heart attack or stroke, serious gastrointestinal problems. If you experience serious side effects, contact your doctor immediately or seek emergency care. What happens if you have an allergic reaction to ibuprofen? Although rare, some people may have allergic reactions to ibuprofen. Symptoms can include rash and itchiness, flushing, severe swelling under the skin, usually in the eyelids, lips, hands, or feet, swelling of the tongue, mouth, or throat, causing difficulty breathing. If you have a severe allergic reaction, seek emergency help immediately. Let's compare ibuprofen with other medications. Ibuprofen versus acetaminophen, aka Tylenol. Both treat pain, but ibuprofen also reduces inflammation, making it suitable for conditions like arthritis. Ibuprofen is more likely to irritate the stomach compared to acetaminophen. Ibuprofen versus naproxen, aka Aleve. Both are non-steroidal anti-inflammatory drugs and treat pain and inflammation. They share similar side effects, such as nausea and heartburn. Ibuprofen versus aspirin. Both relieve pain and inflammation, but aspirin also works as a blood thinner and is often used to prevent blood clots. Let's answer frequently asked questions. Is ibuprofen a blood thinner? No, but it can affect blood clotting slightly. While it isn't classified as a blood thinner like warfarin or aspirin, ibuprofen can make you bleed a bit more easily. Does ibuprofen come in a 200 milligrams tablet? Yes, this is available over the counter. Can I take ibuprofen with tramadol? Yes, if your doctor approves, as there's no known interaction between these medications. What are the important considerations before starting ibuprofen? Discuss your full medical history with your doctor before taking ibuprofen, especially if you have asthma, especially if you have aspirin-sensitive asthma. Heart failure. Non-steroidal anti-inflammatory drugs can worsen heart failure. High blood pressure. Non-steroidal anti-inflammatory drugs can elevate blood pressure. Kidney problems. Ibuprofen can worsen kidney issues. Liver problems. It can cause liver damage. Previous allergic reactions to ibuprofen or its ingredients. Can ibuprofen be taken with alcohol? Avoid alcohol while taking ibuprofen to reduce the risk of severe gastrointestinal issues, including bleeding and ulcers. Can ibuprofen be taken during pregnancy and breastfeeding? In pregnancy, the safety of ibuprofen depends on the stage of pregnancy. Generally, it is not recommended, especially after 30 weeks of pregnancy. In breastfeeding, it's unclear if ibuprofen is safe while breastfeeding. Consult your doctor for advice. What should you do in an overdose of ibuprofen? If you suspect an overdose, seek emergency medical attention immediately. Symptoms can include dizziness, slowed breathing, and bluish skin. How should you take ibuprofen? Always follow your doctor's instructions for taking ibuprofen. If you have trouble reading labels or opening containers, ask your pharmacist for help. Some pharmacies offer large print labels or containers that are easier to open. Which questions should you ask your doctor? When talking to your doctor about ibuprofen, consider asking, how does ibuprofen compare with other pain treatments? Do my health conditions increase my risk of side effects? Can I safely take ibuprofen with other medications like acetaminophen? Remember, always consult your healthcare provider before starting or changing any medication regimen. This ensures you're using ibuprofen safely and effectively for your specific needs. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.